Hi everyone, my name is Maria Zhang. Welcome to the chapter, What Will the Doctor Think? Managing Relationships with Physicians. Upon completion of this module, you will be able to identify strategies to mitigate key tensions between pharmacists and physicians, identify strategies to build relationships with physicians in your practice, and apply techniques to increase collaboration with physicians when caring for shared patients. Pharmacists in Ontario have never been in a better position than now to make a positive and meaningful impact on patients' lives and on the healthcare system. Since 2012, pharmacists in Ontario have been providing increased clinical services to Ontarians, such as renewing or adapting prescriptions based on patients' individual circumstances, administering influenza injections, and prescribing bupropion and varenicline for smoking cessation. As we all know, physicians and pharmacists interact with each other on a daily basis. Both have critical and complementary roles in supporting patients and optimizing their drug therapy. In most scenarios, pharmacists and physicians interact collegially to manage patients' pharmacotherapy needs. However, there are certain cases where tension may arise and consequently lead to decisions that may not be in the best interest of the pharmacist, physician, or most importantly, the patient. Recognizing the complex dynamics between pharmacists and physicians and perceived barriers to collaboration, such as lack of time and remuneration, the focus of this presentation is to discuss key tensions between community pharmacists and physicians, how to mitigate them, while tying in strategies to strengthen relationships and collaboration with physicians in your practice. I'd like for you to reflect on this topic. In your day-to-day practice, what is a key tension that you've identified in your interactions with physicians? How have you managed this? What could have been done to prevent this? Two key tensions that I've identified are miscommunication, especially when making recommendations, which is often related to the next key tension, role ambiguity and mismatched expectations, leading to turf wars between physicians and pharmacists. Let's look at miscommunication. Pharmacists are accustomed to interacting with physicians via fax and sometimes via telephone. While this has generally worked for most product-focused activities, such as clarifying illegible prescriptions or requesting authorizations for prescription refills, relying on fax transmissions is often not the best way to collaborate with physicians in providing patient-centered services. Reflect on when, what, and how communication should occur between you and family physicians in your area. When? At the pharmacy staff level, discuss and recognize which clinical situations would require direct communication with the physician, for example, a change in dose or drug, and which ones can be delegated to others, for example, contacting the secretary in the case of illegible prescriptions. What information do you have access to that the physician does not have and would be useful in improving patient care? In a qualitative study based in Saskatchewan, 96.5% of physicians surveyed reported that they would like pharmacists to notify them if a patient was not regularly refilling his or her chronic medications. Similarly, physicians do not have access to narcotic monitoring system alerts, informing them when their patients may be double doctoring and/or trying to fill controlled substances too early is critical to a clinical assessment. Both of these examples illustrate valuable pieces of information that would A, contribute dramatically to improving patient care and outcomes, and B, demonstrate your value-added services and distinguish your role from the physicians. For the smaller group of prescribers that you either commonly interact with or those who are resistant about communication between them and yourself, have a brief discussion about which forms of communication are best for general scenarios: fax, phone, and/or email communication. Does the physician have a contact number for after hours? And in what scenarios should they be notified at that number? How we communicate our recommendations is at least as important as what we communicate. As pharmacists, we have long been taught to identify drug therapy problems and to solve them. However, when communicating your recommendations to the physicians, whether verbally or in written form, it is important to be respectful of the physician's knowledge, professional judgment, and their relationship with the patient as well. No one likes being told that they've made a mistake or that there's even an issue. As pharmacists, it is important to not get stuck in the role of the prescribing police or pharmacops. So how do we deal with this? When communicating your recommendations, whether verbally or in written form, try this format out if you're not already doing it. Provide 1 to 3 sentences to support your recommendation and then provide it. Conclude with a sentence welcoming collaboration and your contact information. This same format can be used in writing notes to physicians or verbally when speaking with them on the telephone. Here's an example of what you might say or write to a physician. Dear Dr. Singh, during a medication review with Mr. Akash Patel, he disclosed that he's been experiencing excess sedation, impairing his ability to carry out day-to-day activities, with minimal improvement in pain control. I educated him on the role that his hydromorphone may be playing in this, and that other agents may be preferred in managing his diabetic neuropathy. He is open to trying other pharmacotherapy. I recommend tapering his hydromorphone dose while initiating duloxetine 30 milligrams daily for 7 days, then increase to 60 milligrams once daily as tolerated. Please advise. I can be contacted at 705-678-9876. Kind regards, Sarah Wilson. Be concise, clear, confident, and prepared. Own your clinical decisions. Now, let's look at role ambiguity and mismatched expectations. We know that issues commonly arise when roles and expectations are not clearly defined. I've heard pharmacists say, if only the docs knew how much training I've had, what certifications I've obtained, or even what I currently do or could do. On the flip side, I've heard physicians comment, why are pharmacists prescribing? They're not trained to assess and diagnose like we are. So how may we mitigate this? Pharmacists are medication experts. It really should be a collaborative and complementary relationship that is centered around the patient. It's important not to let outdated ideas about a pharmacist's role prevent you from providing the best care possible to patients. Previously, this is what many pharmacists' actions would have been.
This afternoon and start to get the profiles ready. That would be really helpful. Hi, how are you?
I'm good. I'd like to renew my prescription.
Okay, can you start by letting me know your name?
Susan James.
Okay, I have found your medication profiles, and what medications do you need me to refill?
I need my metformin, ramipril, and atorvastatin.
Okay, so I can see the metformin, the ramipril, and the atorvastatin.
Does there seem to be a problem?
Well, I'm seeing here that you actually don't have any refills on any of the medications you're requesting. And I know that Dr. Smith does not actually do any renewals for any of his patients by telephone or by fax. He actually requests that all of the patients make an appointment to see him directly to get a new prescription.
Well, aren't you authorized to make that call? I really need my medication, and I'm all out as of tomorrow morning.
Well, technically I am authorized, and I don't want you to run out of medications. But I really don't want to upset Dr. Smith, and I would feel much more confident if I could just give his office a call and get him to authorize the refills for you. It shouldn't take very long. Do you mind browsing around the pharmacy for a few minutes while I just give the office a quick call?
Sure.
Great, thanks.
But now, with the changing scopes for pharmacists, there is a better way to approach situations such as this.
I'm actually authorized to refill these prescriptions independently for Susan. I can use my own professional judgment based on my assessment. And what medications do you need me to refill?
I need my metformin, ramipril, and atorvastatin.
I can see looking at Susan's profile that she's actually out of refills for all 3 of these medications. And I know that Dr. Smith doesn't authorize renewals via phone or fax. Susan's going to need to make an appointment and go into the office to get new prescriptions. But I know that she needs these prescriptions to manage her diabetes and her cholesterol. And I can also see in the profile that she's been on the same doses, stable, for over 2 years. Metformin, ramipril, and atorvastatin. I see them here. But I noticed you're actually out of refills for all 3 of these medications. But it looks like you've been on stable doses of all of them for at least 2 years. Did Dr. Smith mention that he may make any changes to the medications or any of the doses?
I don't believe he had any plans to change the doses. You're right, I have been on the same dose for a long time.
Okay. Do you remember when you had your last physical with Dr. Smith that included blood work?
My last appointment with blood work, less than 6 months ago. And the doctor noted that everything was good, and the blood work and the tests were in the range that he'd like to see them. And he indicated that the medication would stay the same.
Okay, so that's really helpful. How about side effects? Do you have any side effects from any of these medications?
No side effects, and I tolerate the medication well.
Well, that's great. That's what we like to hear. So, taking all of this into account then, what I'm going to do for you is I'm actually going to refill all of these prescriptions for you for 1 month. By doing that, it will give you time to make an appointment. You'll have to give the office a call to get in to see him. I'll also give them a call to let them know what I've done, and I'll fax my note so that they can put it into your chart. How does all that sound for you?
That's fine.
Okay, Susan, just give me a few minutes and I'll get all of these prescriptions ready for you, and I'll let you know when I'm done. When I have Dr. Smith on the phone, I'm going to take an opportunity to explain to him my role. It's important that he understand that my goal is continuity of care. I also want him to know that I will always inform him of any changes that I make for our mutual patients. I will fax my note so he can put it in the patient's charts. It wouldn't have been appropriate for me to let Susan run out of medications. She either would have been non-adherent until she could get an appointment and a new prescription, or she would have had to go to a walk-in clinic or an emergency room to get a new prescription to bring back to me. Yes, I think this phone call is an excellent opportunity to talk to Dr. Smith and to help him understand my role. He might not like everything that I have to say, but it's a great time to start building rapport with him. Susan, I have your prescriptions all ready for you.
Thank you so much. I am so glad that I won't have to miss any doses of my medication.
Oh, that's great. I'm really glad that I could help. Actually, though, while you're here, I would like to take an opportunity to set up an appointment for a diabetes meds check. It's an appointment that you make with me, and it takes about a half an hour, and it's really just an opportunity for us to spend some time talking about all of your medications. Helps give me some more information so that when we need to make clinical decisions in the future, I already have all of that information for me. How does that sound?
Sure. Wednesday mornings is best for me.
Okay, so how about next Wednesday? I can have our assistant set up an appointment for 9 a.m.?
Great.
Okay, sounds good. So I'll see you next week.
Okay, thanks. Bye.
Bye.
Good afternoon, this is the Family Health Team. Iris speaking.
Oh, hi. Is this Dr. Smith's office?
Yes, it is.
This is Sarah Wilson. I'm calling from ABC Pharmacy.
Hi, Sarah.
Hi, I'm calling about one of Dr. Smith's patients, Susan James.
Yes, I know her quite well.
Okay, great. I'm just calling to let you know that I've refilled some of her chronic medications. I've written a note and I've already faxed it to your office. I'm hoping you can put it in her chart.
Okay, I'll have a look for it.
That's great. And while I have you on the phone, I'd like to request an appointment to talk to Dr. Smith. I really would like an opportunity to explain my role as the pharmacist and help him understand some of the things that I may be involved in caring for some of our mutual patients.
Sure, I have about 15 minutes available for tomorrow at lunch. Does that work for you?
Oh yes, that would be great. Thanks so much.
Okay, have a great day.
Okay, bye-bye.
Be confident in your decisions. Make your presence and your skill set known to physicians. This can be as simple as writing your designations behind your name when making written recommendations, for example, CDE for those who have obtained the certification, or it can be done in more creative and engaging ways. For example, create and fax a monthly one-page newsletter on medication-related topics to prescribers in your area. This could include new Health Canada warnings or indications, updates to the list of medications that prolong QT interval, plus or minus a brief critical appraisal of an article from the primary literature about a new drug therapy. Delegating this project to a pharmacy student is a great way for them to develop their critical appraisal and writing skills, while decreasing the time required for your involvement. Many physicians are looking for readily accessible, unbiased drug information. If you can help meet this need, it will establish rapport. You can also include what patient-centered services are provided by your pharmacy. For example, delivery, compliance packaging. This can be included in the newsletter. Additionally, you can come up with a list of 3 complex patients who would benefit the most from coordinated care between yourself and a prescriber in your area. Then, work the patients up and generate a list of recommendations. This can be done via a meds check or as a separate comprehensive medication assessment. Now, instead of faxing your recommendations to the physician, set up a time to discuss these patients with the physician either in person or over the phone. Finances have been cited as a barrier to collaboration. However, financial incentives have been put in place to encourage interdisciplinary collaboration. In some provinces, physicians are reimbursed for participation in phone consultations initiated by pharmacists for advice about patient care. In Ontario, physicians can bill for a geriatric or pain outpatient case conference with you if there's another regulated healthcare professional in their practice that is involved with the patient's care and can attend the conference. At the same time, pharmacists can bill for their recommendations as pharmaceutical opinions based on drug-related problems which have been identified during a meds check. Not only would this be an efficient way to collaborate and achieve optimal patient outcomes, but also both physicians and pharmacists can be remunerated for this consultation. In summary, pharmacists and physicians have complementary roles in managing patients' pharmacotherapy. By clarifying roles and mutual expectations and optimizing communication with each other, their active collaboration can synergistically improve patients' health outcomes. As Harvard professor and acclaimed author Dr. Atul Gawande writes, "Every change requires effort, and better is possible. It does not take genius. It takes diligence, moral clarity, ingenuity, and above all, it takes a willingness to try." Good luck.